Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about doing treatments during pregnancy and breastfeeding today. We offer a lot of different interventional mental health treatments at Wells Medicine, and pregnancy and breastfeeding are two very different time periods in a woman's life. So I'm going to divide it up into a bunch of different categories. Treatments that are entirely safe during pregnancy, those would include TMS and stellate ganglion blocks. While nitrous oxide and ketamine are both used safely in people who are pregnant for various surgeries and conditions, including infertility treatments. If a pregnant person needs electric shock therapy, ketamine is frequently used. If a person needs a C-section or they need an appendectomy while they're pregnant, ketamine and nitrous oxide can be used safely. We do not administer those at Wells Medicine to patients who are pregnant. Even though they are very safe medications and should cause no problems with the pregnancy or with the developing baby, we try to stay on the side of minimal intervention for our pregnant patients. So that would be TMS, which is very localized to the head and the brain, and stellate ganglion, which is also a similarly very localized administration of medication. For breastfeeding, any of our treatments are very safe and totally acceptable. So as long as the baby is actually outside your body, we've had patients come to us to pick back up treatment as early as 2 weeks after they've delivered. Ketamine, nitrous oxide, stellate ganglion, TMS are all perfectly safe in breastfeeding. There is some controversy as to whether or not for ketamine, patients would need to pump and dump. So that's where if you're breastfeeding, you express the milk and then dump it. You literally pump the milk out and then throw it away. There are some practitioners who prefer the idea of pump and dump because they want to make absolutely certain that there is not one tiny iota of ketamine or a metabolite of ketamine in the breast milk. As far as Wells Medicine is concerned, we don't need you to pump and dump. Just breastfeed right before treatment and then proceed with breastfeeding or pumping as normal. I am much more of the mindset that breast milk is liquid gold, and it is so much work and effort to create it and to pump it, and it is so beneficial to the baby that even if there is the smallest, tiniest iota of ketamine or a metabolite of ketamine in the breast milk, it is so very, very unlikely to affect or harm the baby in any way because the quantities would be so small and so far apart. Even during the initial 6 infusions, they're just so far apart and so small that I say pump and keep, or just proceed on with your normal breastfeeding schedule. The easiest is to breastfeed or pump right before an infusion, and that sort of gives your body time to metabolize and to process before you would do your next scheduled feeding. Again, these medications are used in pregnancy. They're used for C-sections. And when people have C-sections or people have surgery right after pregnancy, they're not asked to pump and dump at that time. And as someone who has gone through the process of breastfeeding and pumping for 3 children, it's quite a process, and I don't take it lightly at all. So, we're happy for you to even bring your baby to the clinic, provided, of course, you have someone who's willing to watch the baby during your treatment. Bring the baby, feed right before your infusion, have your infusion, and then proceed on with your day. So that's just a little bit about the safety of our treatments during pregnancy and breastfeeding.